Welcome to Endophenotypes, Evidence, and Long-Term Outcomes in Moderate to Severe Atopic Dermatitis Management, a Decision Library. I'm Professor Jonathan Silverberg. I'm Director of Clinical Research and Patch Testing at the George Washington University School of Medicine and Health Sciences in Washington, D.C. These are the faculty disclosures, and these are the learning objectives for the program. And now I will get started with Module 4. Accessing care and setting and maintaining atopic dermatitis goals, a panel discussion between clinicians and the patient.
So first, I'd like to just introduce a patient vignette regarding challenges with access to care. And you'll get to hear that right now.
I would count us very fortunate in terms of accessing care, because through our time in dealing with my son and his atopic dermatitis, I've met other people that have really experienced challenges. I think early on, because we visited so many different types of doctors, we learned about prior authorizations and different types of pharmacies and patient assistance or patient assistance programs and those kinds of things, and samples that really help you. Do I think it's been really expensive? Absolutely. So had we not had insurance, I see so many holes. There's so many places where it would not have worked. And even with our insurance and the flexibility of our insurance, it's still been expensive.
Okay, that was an excellent presentation. And now I'll turn it over to Dr. Alexis to lead the discussion.
In my practice in New York City, I treat a very diverse patient population from many different backgrounds. And when I think about the experience of my patients with atopic dermatitis, especially those with skin of color, there are some unique aspects of the condition that I see that also mirror what's in the literature. First of all, there's a tendency for the eczema to also result in some pigmentary changes, which can be just as burdensome to my patients as the eczema itself. There can often be delays in the diagnosis. A lot of my patients have seen other providers and have not yet had the diagnosis of AD until they see me as a dermatologist. And many of my patients have tried all sorts of home remedies and other therapies they might have heard about from their community before getting to what I would consider the ideal treatment that I prescribe to them after making the diagnosis of atopic dermatitis. So I have a patient of mine that I've had for many years with us today, and that's Chris. And I'd love to hear Chris's story of his experience with atopic dermatitis and some of the issues and challenges in terms of getting the right treatment. That's certainly something we've had challenges on over the years.
Thank you so much, Dr. Alexis. So I've had eczema since I was a very young child, and it has had different severity points when I was young and into my adulthood. When I was very young, I had some spurts of very severe eczema where I would have lots of bleeding on my fingers, all over my back and my legs. I had experiences where I felt very sort of ashamed of myself in terms of bearing skins, such as wearing short sleeve shirts or even shorts on the summertime. And so those experiences were very difficult for me, both as a child and as an adult. And not only that, sort of working with my physicians to sort of find solutions to that and being able to get the right treatments to be able to respond to the severity of my condition at those certain points. Through my time, I think I've tried different types of treatment and have been sort of successful in being able to combat some of those conditions throughout those times.
Yeah, one of the challenges that we've had over the years, Chris, is that even after we identified what I felt was the preferred treatment for you that would allow you to be well controlled without dependence on steroids, for example. Once we had found that right match, we hit the wall a few times in terms of trying to get you that medicine. You want to speak to some of those challenges?
Definitely. So at my most severe point in the condition, we worked together and was able to sort of get a treatment plan for some injectable medications that I was on, which actually helped me very, very well, and really brought my condition to being able to be manageable. And throughout that sort of trial period, once it became something that we brought to our to my insurance company, they would not sort of cover the medication. And that became a big battle between them and really getting them to sort of understand that this was the proper treatment for me. And it was the only thing that was actually reaping results that would allow me to sort of have a comfortable level of living, and being able to manage and control my eczema. And so there was definitely a struggle there in being able to get the insurance companies to cover the medication. Unfortunately, without the insurance covering it, the medication was just too expensive for me to cover out of my own pocket. So that was also not a solution in being able to get access to the medication. We worked very closely together, went through many rounds of appeals, and able to try to see if they would be able to sort of recant that and cover the medication, which eventually was not successful at that point in time. But we were able to work with the actual distributor to be able to put me on a patient assistance program where I was able to receive the medication for a few years free of charge. And again, that was a lot of going back and a lot of appeals and a lot of your support in being able to prove that I was eligible to receive this special assistance program in order to receive the medication.
Yeah, I think that patient assistance program was the real breakthrough and really allowed you to have access to that injectable medication that really led to great improvement for your atopic dermatitis. So thank you for sharing that, Chris. You know, it's a story that many patients, I think, can relate to. Now, a work group from the Quad AI Committee on the Underserved developed recommendations for changing social determinants of health and health disparities in allergic and immunologic conditions. And you really highlighted the need for a multi-pronged approach and involvement of multiple stakeholders, including patients, physicians, and other healthcare providers, communities, insurance payers, and government agencies. Recommendations for patients included speaking openly with your doctor about your needs, about cultural differences and social network dynamics that affect family decisions. So in other words, it's important to be transparent and share some of the issues that might be barriers to any of the treatment recommendations. If you don't have one currently, it's recommended that you obtain a primary care physician to coordinate medical care. Primary care physician is critical as a first step in coordinating the bigger picture of your overall health, including referrals to specialists when needed. You want to request educational resources on atopic dermatitis and its treatment, and thankfully there are many such educational resources available online and elsewhere. You want to share your challenges and barriers to care with your healthcare providers, as I mentioned. That could include just challenges getting to and from the point of care, the office or center that might be recommended. Might have to do with costs of getting medication. Sharing those barriers and challenges is key, so that the healthcare provider can help overcome them. You want to join patient advocacy groups that are addressing health disparities. That's something that I would strongly encourage as well, and advocate for government representatives to enact policy changes that can increase insurance coverage and reimbursement rates for specialty care and treatments. And that's something that we can all do, work together to advocate for better access and overcoming many of the barriers to care for atopic dermatitis. So where can you find support? Joining our online community, there's the Asthma and Allergy Foundation of America. It's a safe and secure online support group for people with asthma, allergies and skin conditions like eczema. You can learn from others. It's a great opportunity to learn from others with similar experiences, get and provide support, sharing your story, which can be really helpful and impactful to others, as well as even to one's own self, and participate in research and advocacy. So you can join at the website below, which is aafa.org/community. What about help affording atopic dermatitis treatment? Well, pharmaceutical companies have a whole host of patient assistant programs, and these assistance programs are provided by the pharmaceutical companies that manufacture the treatments for AD. And in many cases, they can offer free or low-cost medications to people who may not be able to afford them. And this is really key to getting access when there's particularly when there's a financial barrier. So you can search for your medication online and look for their specific pharmaceutical company patient assistant program. And you can talk to your doctor to find out how to access help for this. Most of us that prescribe are very familiar with these. So what else? Well, there are local, state, and federal government programs, including Medicare's prescription drug program. We have RX Assist and Needy Meds. This can help you find prescription assistance from state or local government. There are nonprofit programs, such as the PAN Foundation, Medicine Assistance Tool, and RX Outreach. And you can see more information there on the slide.
That was an excellent discussion. Thank you very much. I would like to thank Sanofi and Regeneron Pharmaceuticals for the support of this important educational activity. Please remember to complete the post-test at the end of the session to secure your CME credits. Stay tuned for our companion session titled Disparity and Equity in Moderate to Severe Atopic Dermatitis Care, Enhancing Access to Multidisciplinary Care for Patients from Diverse Populations, broadcasted live on Immunology Live on Monday, October 24th, from 8 to 9 p.m. Eastern Time. My name is Dr. Jonathan Silverberg, and thank you for joining us.